Are you ready to master the musculoskeletal system for your NCLEX? In this video, we're going through 100 must-know questions and answers that will boost your confidence and help you crush the exam. Stick with me till the very end, because each question builds your knowledge step by step, and the last set could be the game changer you need to pass on your first try. Let's dive in. 1. Which of the following is the functional unit of a muscle? A. Sarcomere. B. Myofibril. C. Fascicle. D. Muscle fiber. Answer: A. Sarcomere. 2. The largest sesamoid bone in the human body is A. Hyoid bone. B. Patella. C. Pisiform. D. Calcaneus. Answer: B. Patella. 3. Which type of joint is the hip joint? A. Hinge joint. B. Ball and socket joint. C. Pivot joint. D. Saddle joint. Answer: B. Ball and socket joint. 4. The primary mineral stored in bones is A. Sodium. B. Potassium. C. Calcium. D. Chloride. Answer: C. Calcium. 5. Osteoblasts are responsible for A. Bone resorption. B. Bone formation. C. Bone mineralization only. D. Cartilage formation. Answer: B. Bone formation. 6. The axial skeleton includes all of the following except A. Skull. B. Ribs. C. Sternum. D. Clavicle. Answer: D. Clavicle. 7. The neurotransmitter at the neuromuscular junction is A. Dopamine. B. Acetylcholine. C. Serotonin. D. Norepinephrine. Answer: B. Acetylcholine. 8. Which type of muscle is involuntary and non-striated? A. Skeletal muscle. B. Cardiac muscle. C. Smooth muscle. D. Intercostal muscle. Answer: C. Smooth muscle. 9. Kyphosis is an abnormal curvature of the spine in which direction? A. Forward cervical curve. B. Backward thoracic curve. C. Lateral curve. D. Forward lumbar curve. Answer: B. Backward thoracic curve. 10. Which bone is commonly fractured in a Coles fracture? A. Ulna. B. Radius. C. Humerus. D. Clavicle. Answer: B. Radius. 11. The main protein in bone matrix is A. Elastin. B. Collagen. C. Keratin. D. Actin. Answer: B. Collagen. 12. Which vitamin is essential for calcium absorption? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin D. Answer: D. Vitamin D. 13. Gout is caused by the accumulation of A. Lactic acid. B. Uric acid. C. Citric acid. D. Oxalic acid. Answer: B. Uric acid. 14. Which of the following bones forms part of the axial skeleton? A. Femur. B. Tibia. C. Vertebrae. D. Humerus. Answer: C. Vertebrae. 15. The connective tissue surrounding a muscle fiber is called A. Epimysium. B. Paramysium. C. Endomysium. D. Myofibril. Answer: C. Endomysium. 16. Which type of fracture is most common in children? A. Comminuted fracture. B. Greenstick fracture. C. Spiral fracture. D. Compression fracture. Answer: B. Greenstick fracture. 17. The sternocleidomastoid muscle is involved in A. Flexion of the knee. B. Rotation of the head. C. Extension of the arm. D. Flexion of the fingers. Answer: B. Rotation of the head. 18. Which hormone stimulates bone resorption by osteoclasts? A. Calcitonin. B. Parathyroid hormone. C. Insulin. D. Thyroxine. Answer: B. Parathyroid hormone. 19. The smallest bone in the human body is A. Stapes. B. Incus. C. Hyoid. D. Lacrimal bone. Answer: A. Stapes. 20. The acetabulum is part of which bone? A. Scapula. B. Pelvis. C. Femur. D. Tibia. Answer: B. Pelvis. 21. The bone that does not articulate with any other bone is A. Mandible. B. Hyoid. C. Maxilla. D. Temporal. Answer: B. Hyoid. 22. Which type of muscle contraction shortens the muscle while producing movement? A. Isometric. B. Isotonic, concentric. C. Eccentric. D. Tonic. Answer: B. Isotonic, concentric. 23. Scoliosis refers to A. Lateral curvature of the spine. B. Forward bending of the lumbar spine. C. Posterior bending of the thoracic spine. D. Rotation of the cervical spine. Answer: A. Lateral curvature of the spine. 24. The shoulder joint is stabilized primarily by A. Biceps brachii. B. Deltoid muscle. C. Rotator cuff muscles. D. Pectoralis major. Answer: C. Rotator cuff muscles. 25. Which bone is commonly fractured in osteoporosis? A. Femur neck. B. Humerus. C. Tibia. D. Radius head. Answer: A. Femur neck. 26. Which muscle is known as the calf muscle? A. Soleus. B. Sartorius. C. Gastrocnemius. D. Tibialis anterior. Answer: C. Gastrocnemius. 27. The main weight-bearing bone of the leg is A. Tibia. B. Fibula. C. Femur. D. Calcaneus. Answer: A. Tibia. 28. Rickets is caused by a deficiency of A. Vitamin C. B. Vitamin D. C. Vitamin K. D. Calcium. Answer: B. Vitamin D. 29. The functional classification of joints that allow free movement is A. Synarthrosis. B. Amphiarthrosis. C. Diarthrosis. D. Synchondrosis. Answer: C. Diarthrosis. 30. The scapula articulates with which bone to form the shoulder joint? A. Clavicle. B. Humerus. C. Sternum. D. Radius. Answer: B. Humerus. 31. Which muscle is called the kissing muscle? A. Zygomaticus. B. Masseter. C. Orbicularis oris. D. Buccinator. Answer: C. Orbicularis oris. 32. Which connective tissue attaches muscle to bone? A. Ligament. B. Tendon. C. Cartilage. D. Fascia. Answer: B. Tendon. 33. Which bone forms the forehead? A. Parietal bone. B. Frontal bone. C. Temporal bone. D. Occipital bone. Answer: B. Frontal bone. 34. The primary movement at the elbow joint is A. Rotation. B. Flexion and extension. C. Abduction and adduction. D. Circumduction. Answer: B. Flexion and extension. 35. Which of the following is a flat bone? A. Femur. B. Radius. C. Sternum. D. Tibia. Answer: C. Sternum. 36. Which of these is not part of the appendicular skeleton? A. Femur. B. Clavicle. C. Vertebra. D. Ulna. Answer, C. Vertebra. 37. Which bone houses the pituitary gland? A. Temporal bone. B. Ethmoid bone. C. Sphenoid bone. D. Frontal bone. Answer, C. Sphenoid bone. 38. The anatomical term for the heel bone is A. Talus. B. Calcaneus. C. Cuboid. D. Navicular. Answer, B. Calcaneus. 39. The long bone growth occurs at A. Epiphyseal plate. B. Periosteum. C. Endosteum. D. Medullary cavity. Answer, A. Epiphyseal plate. 40. Which muscle is the prime mover for inspiration? A. Intercostal muscles. B. Diaphragm. C. Pectoralis major. D. Latissimus dorsi. Answer, B. Diaphragm. 41. Which bone is known as the collar bone? A. Humerus. B. Clavicle. C. Scapula. D. Sternum. Answer, B. Clavicle. 42. Which is the strongest bone in the human body? A. Femur. B. Tibia. C. Humerus. D. Radius. Answer, A. Femur. 43. In rheumatoid arthritis, the primary site of inflammation is A. Tendons. B. Joint capsule. C. Synovial membrane. D. Cartilage. Answer, C. Synovial membrane. 44. Which type of joint is found between the atlas and axis, C1 and C2 vertebrae? A. Hinge. B. Pivot. C. Saddle. D. Ball and socket. Answer, B. Pivot. 45. Which bone is commonly affected in a boxer's fracture? A. First metacarpal. B. Fifth metacarpal. C. Radius. D. Ulna. Answer, B. Fifth metacarpal. 46. The anatomical snuff box is located near which bone? A. Radius. B. Ulna. C. Scaphoid. D. Humerus. Answer, C. Scaphoid. 47. The quadriceps femoris group includes all except A. Rectus femoris. B. Vastus lateralis. C. Vastus intermedius. D. Biceps femoris. Answer, D. Biceps femoris. 48. The structural unit of compact bone is A. Osteon, Haversian system. B. Trabeculae. C. Periosteum. D. Endosteum. Answer, A. Osteon, Haversian system. 49. Which condition is characterized by decreased bone density and increased fracture risk? A. Osteoarthritis. B. Osteoporosis. C. Osteomyelitis. D. Rickets. Answer, B. Osteoporosis. 50. The Achilles tendon connects which muscle to the calcaneus? A. Tibialis anterior. B. Gastrocnemius and soleus. C. Sartorius. D. Peroneus longus. Answer, B. Gastrocnemius and soleus. 51. Which of the following bones is not part of the skull? A. Ethmoid. B. Mandible. C. Scapula. D. Sphenoid. Answer, C. Scapula. 52. The joint between the frontal bone and parietal bone is A. Synchondrosis. B. Suture. C. Syndesmosis. D. Gomphosis. Answer, B. Suture. 53. The epimysium surrounds A. Individual muscle fiber. B. A fascicle. C. The entire muscle. D. Myofibrils. Answer, C. The entire muscle. 54. A comminuted fracture is best described as A. Bone bent but not broken. B. Bone broken into many pieces. C. Bone crushed. D. Bone twisted apart. Answer, B. Bone broken into many pieces. 55. The mandible articulates with which bone? A. Temporal bone. B. Maxilla. C. Frontal bone. D. Occipital bone. Answer, A. Temporal bone. 56. Which muscle is responsible for abduction of the arm at the shoulder? A. Deltoid. B. Biceps brachii. C. Trapezius. D. Latissimus dorsi. Answer, A. Deltoid. 57. The zygomatic bone is commonly known as the A. Cheekbone. B. Jawbone. C. Forehead bone. D. Nose bone. Answer, A. Cheekbone. 58. The menisci in the knee joint are made of A. Elastic cartilage. B. Fibrocartilage. C. Hyaline cartilage. D. Ligamentous tissue. Answer, B. Fibrocartilage. 59. Which bone is also known as the breastbone? A. Scapula. B. Clavicle. C. Sternum. D. Hyoid. Answer, C. Sternum. 60. Which muscle is the main extensor of the forearm at the elbow? A. Biceps brachii. B. Triceps brachii. C. Brachialis. D. Supinator. Answer, B. Triceps brachii. 61. Flat bones develop by which type of ossification? A. Endochondral ossification. B. Intermembranous ossification. C. Fibrous ossification. D. Secondary ossification. Answer, B. Intermembranous ossification. 62. The funny bone is associated with which nerve? A. Median nerve. B. Radial nerve. C. Ulnar nerve. D. Axillary nerve. Answer, C. Ulnar nerve. 63. Which type of muscle fibers are adapted for endurance and aerobic metabolism? A. Fast glycolytic fibers. B. Slow oxidative fibers. C. Fast oxidative fibers. D. Mixed fibers. Answer, B. Slow oxidative fibers. 64. Which muscle is responsible for plantar flexion of the foot? A. Tibialis anterior. B. Gastrocnemius. C. Sartorius. D. Rectus femoris. Answer, B. Gastrocnemius. 65. The primary function of red bone marrow is A. Fat storage. B. Blood cell production. C. Mineral storage. D. Joint lubrication. Answer, B. Blood cell production. 66. The carpals are classified as which type of bone? A. Long bones. B. Short bones. C. Flat bones. D. Irregular bones. Answer, B. Short bones. 67. Which joint is the most mobile in the body? A. Elbow. B. Hip. C. Shoulder. D. Wrist. Answer, C. Shoulder. 68. The linea alba is A. Cartilaginous joint. B. Ligament between pubic bones. C. Fibrous band in the midline of the abdomen. D. Tendon in the forearm. Answer, C. Fibrous band in the midline of the abdomen. 69. Which bone articulates with the tibia to form the ankle joint? A. Calcaneus. B. Talus. C. Fibula. D. Cuboid. Answer, B. Talus. 70. The power stroke in muscle contraction is caused by A. ATP hydrolysis. B. Calcium release. C. Myosin pulling actin. D. Troponin binding. Answer, C. Myosin pulling actin. 71. Which bone is most commonly fractured in the elderly? A. Femoral neck. B. Radius shaft. C. Ulna. D. Fibula. Answer, A. Femoral neck. 72. The acromion is a projection of which bone? A. Clavicle. B. Scapula. C. Sternum. D. Humerus. Answer, B. Scapula. 73. What is the main function of ligaments? A. Connect muscles to bone. B. Connect bone to bone. C. Store minerals. D. Produce red blood cells. Answer, B. Connect bone to bone. 74. The sacrum is formed by the fusion of how many vertebrae? A. 3. B. 5. C. 7. D. 9. Answer, B. 5. 75. Which muscle is used in intramuscular injections in infants? A. Gluteus maximus. B. Vastus lateralis. C. Deltoid. D. Rectus femoris. Answer, B. Vastus lateralis. 76. The tibia is located in the A. Upper arm. B. Forearm. C. Thigh. D. Leg. Answer, D. Leg. 77. Which of the following bones belongs to the pectoral girdle? A. Clavicle. B. Femur. C. Sacrum. D. Radius. Answer, A. Clavicle. 78. The annulus fibrosus and nucleus pulposus are parts of A. Knee meniscus. B. Intervertebral disc. C. Shoulder joint capsule. D. Elbow joint. Answer, B. Intervertebral disc. 79. Which muscle is called the Taylor's muscle? A. Sartorius. B. Rectus femoris. C. Biceps femoris. D. Soleus. Answer, A. Sartorius. 80. The trochlea of the humerus articulates with which bone? A. Radius. B. Ulna. C. Scapula. D. Clavicle. Answer, B. Ulna. 81. The anterior cruciate ligament, ACL, prevents which movement? A. Backward movement of tibia. B. Forward movement of tibia. C. Side-to-side movement of tibia. D. Rotation of femur. Answer, B. Forward movement of tibia. 82. The mastoid process is part of which bone? A. Occipital. B. Temporal. C. Sphenoid. D. Parietal. Answer, B. Temporal. 83. The primary action of the pectoralis major muscle is A. Abduction of the arm. B. Adduction and medial rotation of the arm. C. Extension of the arm. D. Flexion of the wrist. Answer, B. Adduction and medial rotation of the arm. 84. A pathologic fracture occurs when A. Bone breaks due to trauma. B. Bone breaks spontaneously due to disease. C. Bone bends but does not break. D. Bone breaks during surgery. Answer, B. Bone breaks spontaneously due to disease. 85. The olecranon process is part of the A. Radius. B. Ulna. C. Humerus. D. Scapula. Answer, B. Ulna. 86. Which bone forms the posterior part of the hard palate? A. Maxilla. B. Palatine bone. C. Zygomatic bone. D. Vomer. Answer, B. Palatine bone. 87. The trapezius muscle is innervated by A. Cranial nerve 11, accessory nerve. B. Cranial nerve V, trigeminal. C. Cranial nerve 7, facial. D. Cranial nerve 12, hypoglossal. Answer, A. Cranial nerve 11, accessory nerve. 88. The hammer toe deformity affects which joint? A. Hip joint. B. Knee joint. C. Interphalangeal joint. D. Ankle joint. Answer, C. Interphalangeal joint. 89. Which bone is commonly affected in cleft palate? A. Maxilla. B. Mandible. C. Sphenoid. D. Frontal bone. Answer, A. Maxilla. 90. The main function of yellow bone marrow is A. Hematopoiesis. B. Fat storage. C. Production of cartilage. D. Calcium absorption. Answer, B. Fat storage. 91. Which muscle is commonly used for intramuscular injections in adults? A. Trapezius. B. Gluteus maximus. C. Gluteus medius. D. Soleus. Answer, C. Gluteus medius. 92. The foramen magnum is located in which bone? A. Frontal bone. B. Occipital bone. C. Temporal bone. D. Parietal bone. Answer, B. Occipital bone. 93. Which bone is involved in carpal tunnel syndrome? A. Pisiform. B. Scaphoid. C. Hamate. D. Carpal bones forming tunnel, ESP pisiform and hamate. Answer, D. Carpal bones forming tunnel, ESP pisiform and hamate. 94. Which muscle is responsible for extension of the knee? A. Hamstrings. B. Quadriceps femoris. C. Gastrocnemius. D. Tibialis anterior. Answer, B. Quadriceps femoris. 95. The medial malleolus is part of the A. Fibula. B. Tibia. C. Femur. D. Talus. Answer, B. Tibia. 96. The temporomandibular joint, TMJ, is classified as A. Ball and socket joint. B. Hinge and gliding joint. C. Pivot joint. D. Saddle joint. Answer, B. Hinge and gliding joint. 97. Which bone is most commonly fractured in the wrist? A. Hamate. B. Pisiform. C. Scaphoid. D. Lunate. Answer, C. Scaphoid. 98. Which bone is known as the ankle bone? A. Talus. B. Calcaneus. C. Navicular. D. Cuboid. Answer, A. Talus. 99. The primary function of osteoclasts is A. Build bone matrix. B. Break down bone tissue. C. Store calcium. D. Produce cartilage. Answer, B. Break down bone tissue. 100. The largest muscle in the human body is A. Deltoid. B. Gluteus maximus. C. Quadriceps femoris. D. Latissimus dorsi. Answer, B. Gluteus maximus. Great job making it through all 100 musculoskeletal NCLEX questions. Party popper, every question you practice brings you one step closer to passing your exam with confidence. If you found this helpful, don't stop here, check out my video on NCLEX lab values you must memorize. It's another high-yield topic that could easily show up on your exam. I'll see you there.